Genetic testing can provide doctors a vast array of useful data when treating patients, everything from genetic markers for Alzheimer's to how certain medications will interact with an individual. Today, Dr. Tom Rogers from Performance Medicine discusses the importance of genetic testing when putting together a treatment plan for his patients.
I want to talk to you about something very important that we've done at Performance Medicine for 2 or 3 years. It's called genetic testing. It's my feelings that in the future with medicine, we're going to do a lot of treatment based on your particular gene. It's going to be more individualized. And we've hooked up with a new company called Integra Labs. We have as our guest here Taffy Barb, who is their senior consultant. We've worked together for several months. And I like the way your company does these tests, not only because of the insurance, because the information that we're able to get in this test. Tell me a little bit about your company.
Okay, Dr. Rogers, thank you so much for allowing me to be here with you today. Integra Lab is a regional lab. We're primarily on the East Coast. Our name implies exactly what we strive to do every day. We want to have integrity to provide the best possible reports to our providers and patients, and we want to extend that even into billing and also into customer service, and that's where I come in.
Well, I'm glad you're here because we have worked with some companies that were more national. I like the fact that you're local and you get a world-class test out of this. Now, what I think is important when we do these tests, really for a couple reasons. One is to check your genotypes, whether you have the Alzheimer's gene, which doesn't mean you're going to get the disease of Alzheimer's. It just tells us if you're predisposed to that at an earlier age and what to do about it. If you have a certain blood clotting disorder, if you have the MTHFR gene, which we work with a lot with methylcobalamin and methylfolate. But the main thing I use this test for, and every doctor can use, is almost every medicine that you can take, it'll tell us if your DNA is matched up with that medicine.
Exactly.
And a lot of times, like say an antidepressant or an antihypertensive or cholesterol medication, sometimes even in the same class, one will be good for you, the other one won't.
Right.
Can you kind of talk about that?
Correct. Your genotype is never going to change, obviously, but your phenotype can change. So
the way the gene's expressed.
Exactly.
Okay.
So you can be a poor metabolizer, you can be a rapid metabolizer, or a normal metabolizer. But even if you're a normal metabolizer, you can have inducers and inhibitors, which can increase or decrease that medication's effect on your system.
I love this test because it's a one-time deal. Your genes won't change. So it enables us to kind of tell and even give your own doctor a copy to decide which medicines you should or shouldn't take.
Right.
Now tell me about insurance with this. It's very important. Does insurance cover this test?
Absolutely. And we strive to make it as easy on the patients as possible. We do not balance bill. So a patient primarily would expect to see any sort of outstanding balance for deductible or coinsurance. And even with that, our billing department is very compassionate and they take everybody's financial status into account. So we work with patients on a one-to-one basis.
In my experience, people have had to pay nothing or barely nothing for this test. It should be worth thousands of dollars, and it's just a wonderful thing. Thank you for coming today. If you decide you want to get this genetic test, just come in and any of our Performance Medicine locations, and we'll run this test for you. It's just a salivary swab, no blood involved.